Succinylcholine is a depolarizing neuromuscular blocker. What's up, you guys? It's your ER pharmacist, Lil Pharma. Today we are continuing our RSI series where we're talking about RSI meds and how to understand them rather than memorize them. The first paralytic I try to use when we're thinking of doing an RSI is succinylcholine. So succinylcholine is a depolarizing neuromuscular blocker, meaning that it activates the acetylcholine receptors, causes a depolarization, and then ultimately leads to paralysis. This is different from our non-depolarizing agents like rocuronium, which we'll talk about in the next video. So that's why you might see those muscle fasciculations when you first give it, but then it causes paralysis, flaccid paralysis after that. So it can also shift potassium out of the cell. So this is why we worry about it in hyperkalemia. So if someone has a known hyperkalemia, major trauma, burns, crush injuries, things like that, we want to avoid succinylcholine because it also causes the potassium to come out of the cells in those crush injuries. So we want to avoid succinylcholine to avoid a catastrophic hyperkalemia. We can also see malignant hyperthermia with succinylcholine, again, because it's depolarizing those acetylcholine receptors, opening those calcium channels, and allowing for calcium to come through and cause muscle contraction. Very rare, but if they're at risk for it or have a history of it, it can open those calcium channels and continue that muscle contraction to a point where someone's having these sustained muscle contractions and can cause problems. So for that, we would give a medication called dantrolene, just blocks those calcium channels. Dosing for succinylcholine, we're going to dose this at 1 to 1.5 mg per kg. So typically it'll be a 1.2 mg per kg dose. For succinylcholine, you're always giving it after your induction agent because it has a very rapid onset, and so you don't want somebody to be paralyzed before they're sedated. Okay, that's what I got for you for succinylcholine. Bye!